safer in place, maintain your space, and cover your face. Hi, I'm Catherine Sonquist Forrest, a family physician and also a public health specialist. As the epidemic was spreading into California, I was watching closely what was happening in January in Washington, because in my role as the co-chair of the Encompass Community Services, we have residential care facilities for people that are chronically mentally ill, psychiatric residential services, as well as substance abuse, youth services, etc. I was very concerned that as the epidemic, very soon becoming pandemic, came, it would be incumbent upon us to protect our residential populations because they really don't have a good place to go or how to be isolated within their residences. Therefore, when we had our first cases in California and then in Santa Cruz, one of the things that concerned me greatly was that there was already a shortage of personal protective equipment for the people that work very closely with these populations. And I was concerned, based on those cases in Washington, that we would need to get personal protective equipment, and then already we couldn't. So my activism came initially from how to protect Santa Cruz's most vulnerable populations, and then looking more closely across the nation at the epidemic, seeing that the front lines, my colleagues in family medicine, in emergency care and urgent care, were being asked to go into healthcare settings without adequate personal protective equipment. The standard of care where there's an infection spread by droplets is protective equipment, masking, N95 in high-risk situations, surgical masks in mid-range situations, and we don't have enough of those things. And in fact, no one in the globe has enough of those things. So it's very concerning to me that we ramp up. PPE, personal protective equipment, is risk stratified. All medically certified equipment should be in the hands of medical professionals right now for the front lines. The rate of COVID across the nation is the very highest in those that are taking care of people in hospitals. Get those N95s, get those surgical masks to the people that you need to take care of you if you are sick. The most important thing for slowing down the virus is stay at home, safer at home. People should stay at home, but many people need to be out in society for their work to be done, and social distancing is useful and helpful and crucial. But also, this is a droplet spread virus, and we need to also message carefully that covering our faces works. So don't go out if you don't have to, but many people do for many reasons. People need to go out to harvest our food. Right now, the farm workers are getting into buses or driving together in trucks to go build affordable housing. Or they're healthcare workers, or they're in grocery stores and they're your cashiers. Lots of reasons people need to be out working, and there's those of us that need to be out getting these services, waiting in line to get important medical services, etc. The rate of COVID across the nation is the very highest in those that are taking care of people in hospitals. Get those N95s, get those surgical masks to the people that you need to take care of you if you are sick. And everyone else should be covering their face with whatever you got. So the CDC came out with this thing about wearing masks and bandanas, and in my heart of hearts, it's tragic that we have not been able to ramp up our society to provide better protection for our healthcare workers and for our workers, all our workers that have essential services. But in these times, use what we have. 17th of March, I reached out to Idea Fab Labs when I saw that people were doing some testing without barriers and they didn't have the personal protective equipment they need. I said, let's look at what other nations did to create plexiglass barriers. They've created some. They will be dispersed. I reached out and said, what can we do around face shields? Let's disperse some plans to our 3D printers around the county. They've done that. And again, it's not just me. There's a lot of minds on this that are out in the community. This is Santa Cruz County. This is Monterey County. The Central Coast is brilliant. And then the third thing was to really try and activate, to mobilize around the concept of masks. And what I'm talking about is cloth masks and trying to use industrial hygiene principles to create a better mask. What do we know about seal around the face, around a molded nose bridge, a seal around the cheek and the chin, elastic around the back, a better mask than the do-it-yourself mask. Not to denigrate, those are fine, and we can also be innovating new design. So together with Idea Fab Labs and with the encouragement and sponsorship of Encompass Community Services, we put together a startup funded by GoFundMe that actually hires people in our community to do the sewing for this design that we have been working on. So they laser cut the fabric, put together kits, we distribute them, and we pay people in their homes to manufacture masks, and then we distribute them right now mostly to the nonprofits that are not even on the distribution list for the national stockpile or the county. So we're talking about people who work in the psychiatric inpatient unit, people that work in the residential care for instance, Encompass. We're talking about Safeway workers. We're talking about farm workers. We're trying to find people that may not be able to get access to this themselves, and we're actively fundraising to try and hire people who are economically impacted by the downturn caused and the unemployment caused by the pandemic and the safer in place regulations, which are so crucial to all of our health. We're trying to raise money in order to be able to distribute them to the homeless outreach workers and also to the homeless. 100% of donations currently go for materials, and people that are interested in donating their labor can do the sewing and then contribute their labor. If you can't contribute your labor, the funding is also for paying people to sew them. And we are prioritizing vulnerable populations for now. We've made the design open source. It's on our website through our partnership now with the Santa Cruz and Monterey County Medical Societies. The CMA has also underlined the importance of masking everywhere if you're out. So they're on board, and they are also doing fundraising to help protect our vulnerable populations, such as homeless, working populations that are otherwise not included in these efforts. So absolutely our most vulnerable populations.
If people want to make donations, where can they go?
So the county is doing coordination of donations of N95s and surgical masks in unopened boxes only. And they have a website listed currently on the county's COVID-19 website. And those should go to the county. They will prioritize directly to people who have the highest risk. If you go onto our site, we can also take those. We will also take opened boxes and distribute them as well. I believe the county is only taking unopened boxes now. That may change, but for now, that's my understanding. But we will take any donations and then quarantine them and then distribute them. We're really encouraging and trying to coordinate if people are doing sew at home, do it yourself, to use our design. It's listed on the website. You can access it through cruzmed.org, cruzmed.org, or directly at ppe4cc.com. That's the part of the project PPE for the Central Coast. It's Santa Cruz and Monterey counties, PPE number 4cc.com. There's many designs out there, but we believe that our mask has enough of the design features that will be supported in the literature. Right now, the science cannot keep up with our need for innovation. So whatever you can do is fine, but our suggestion is to use our mask and then distribute. If you decide to do it at home, and by all means do, distribute widely. You can distribute directly if you want to anyone who doesn't require it for the medical setting. And if you want to participate, we will prioritize to vulnerable groups in our distribution networks.
If people are sewing these masks at home, do they need to sanitize them before they distribute them?
Our recommendation is that when you sew them at home, you first wash your hands, make your own mask, wash your own facility, and then make them, put them into a paper bag, and we sterilize at the other end. So a recipient sterilizes them at the other end. They wash their hands, They put them in an oven at 160 to 170 degrees for 30 minutes. That ensures that they've been sterilized at the recipient end.
If people start putting on these masks, I'm talking about ordinary people, to use them if they have to go out, when they get home, what do they do? Do they wash them? Do they put them in their oven? How do they keep them sterile so they can keep using the same mask?
That's a great question. So the thing that you want to do is to make sure that you have a clean mask, clean it every day, wash your hands, put on your clean mask, and go out. When you get home, take your mask off, buy the elastic, carefully take it off, and put it onto a baking sheet and wash your hands. And then that goes into the oven for 30 minutes at 160 to 170 degrees. Wash your hands again and take it out, and it's ready for use. It should be washed once a day, at least once a day, or preferably after every time you go out.
You are also, I understand, through the Fab Lab, going beyond the idea of masks and doing other kinds of protective equipment as well. So perhaps you could speak a little about that.
That's correct. Our manufacturing advantage is laser cutting of the fabric, because that's the rate limiting step for people being able to make many masks. We're thinking to continue that mass manufacture of the mask shape and then sending those out in the kits. Probably continue that. We're still looking for other laser cutters for fabric. So if anyone has access to laser cutter for fabric, we're really interested in that, because that speeds up production of masks. And of course, do it yourself. People can continue doing that. The other things we've been working on is face shields. Face shields can be used in conjunction with N95 masks or surgical masks or cloth masks and improve their ability to protect against droplet spread. So face shields are being produced across Santa Cruz and Monterey counties. We've been in conversations in partnership with Joby, which is a local aeroscience company. And we've been in conversations with a number of smaller groups, including the Cabrillo group, the Bonnie Doon group. And we're hoping to continue the face shield production and distribution. They are using 3D printers for that to make the foam part that is on the head. And then the tricky part is gearing out access to the plastic shield, because that material is drying up globally. So looking at alternatives for that and figuring that out has been key. Idea Fab Labs has a partner in Chico. They're in both sites, Chico and Santa Cruz, and they're being produced in both places. The third thing that we're looking at actively is a design for N95 masks, specifically the Montana mask, which actually has been tested for its N95 capacity. And we're looking to see whether or not it's possible to ramp that up locally or in Santa Clara County, because shortage of N95 masks for healthcare workers that do high-risk procedures or care for high-risk patients in the hospital. Again, I would like to emphasize the importance of reserving N95 masks into the medical field. People are caring for people that are seriously ill, and it's not necessary for the exposure level that most of us have in going out for essential services or for most occupations.
Is there anything you'd like to add about what is likely to happen in the next 3 to 4 weeks?
I think most Santa Cruz County's models show that flattening the curve has worked, and what that means is we've slowed down the spread of the virus. But that does not mean that we're not seeing an increase, and our peak will be in about towards the end of April, beginning of May, and it will spread out. And the only way for us to keep it flattened is by continuing staying at home. My most important message is do that, stay at home, and try and, when you do go out, to wear the mask, because the thing that will keep us from not giving the virus to others, that is also in our own best interest for not getting the virus, our friends and families not getting the virus, and protecting our healthcare workforce, is to cover your mouth when you go out. So Riverside County's motto, I believe, is the right one: safer in place, maintain your space, cover your face, in that order. So be safe and know that those of us that are in healthcare are working for you. We're all in this together.
Thank you so very much.
Thank you for spreading the word, and the media staying engaged in this in a positive way. And I want to make sure that everybody also hears how important it is to just take deep breaths and enjoy the beauty. Stay connected with your faces, with your voice, with those that you love. Never miss the opportunity to connect. That's probably the most important thing we're doing. It's virtual in a different kind of way than we've ever done before, but it is probably the thing that's going to keep us going through this tough time.
So, hi, my name is Jonna, and I live in Santa Cruz, California, and I'm a home sewer, and I have worked in the healthcare field for a long time. And I started making masks because I have been on the internet a lot over the last couple of months, and I have really followed the outbreak of the coronavirus. It really kind of all started for me because I was very focused on what is happening in Hong Kong with the protests there. And then as the coronavirus started spreading and the people in Hong Kong were fighting to close their borders for people coming from China, I started looking into what this disease actually is. And I quite frankly got very, very frightened. I started seeing videos from people first in China, but then also individuals later on in other countries cheerfully saying, don't believe what they tell you, wear a mask. No matter what they tell you, wear a mask. And I then started looking into various kinds of mask designs, trying to figure out, because obviously we don't have enough healthcare masks. We cannot go out and start hoarding the surgical mask and the N95 masks that our healthcare providers are dependent on for their lives, literally those on the front lines. So I started looking into, just with my knowledge of fabric and whatnot, like what is a medical mask, what makes it as safe as it is, as protective as it is, and how can I use materials that is already readily available in Santa Cruz County to emulate some of the aspects of these masks. In addition to that, I'm also a master recycler, and I do not really like the whole idea of use and throw away single-use items. We have to have that in the healthcare setting, of course, but in our general lives, I think it is possible to come up with masks that essentially will function a little bit kind of like you wear underwear. I mean, you have masks that go into your laundry and you have them ready, and when you go out, if you're going to the grocery store, if you're going anywhere, if you're socializing, even if you're maintaining that 6 feet distance, you wear a mask for the extra protection. We've always learned that when you cough or when you sneeze into your elbow. But what we don't consider is the fact that as we talk and as we breathe out and talk out droplets. And if we're infected with any kind of virus, then that virus is tiny enough to float around in all those droplets. So it's even just a matter of us talking with each other, where having those extra layers really make a difference. So I started looking at the different types of fabric that they use. So what they use in the healthcare profession is what is considered heat-blown masks. And the material that they use really is much more similar to paper than to actual fabric, in that it's not woven. All of the fibers are kind of chaotic, if you will, which create a certain type of grid. Now, the woven fabrics also create a grid, but because of all of the little holes that are going to be naturally in between all of the threads in woven fabric, it's much more permeable than paper is. The advantage, of course, being that it's stable, it's washable, and you can breathe through it, which is hugely helpful. So I started playing around with how can you create a really tight grid that has a fighting chance of catching small droplets, even though it's made from materials that are readily available here in Santa Cruz County, because we do not have the time to import anything from China or from any other country right now. We really need to work with what we have readily available. And what I came up with were layers of fabric that was cut straight on the grain so that the threads go up and down and then side to side, and then cutting another layer on the bias so that all the threads go on a 45-degree angle to kind of create a little bit of a tighter filter there. And then in addition to that, I put a layer of fusible interfacing, because the interfacing, I mean, you can get woven interfacing, but the interfacing that I use is also heat blown, and therefore creates that kind of layer of chaotic fibers that kind of help, again, a little bit of glue. It does mean breathing interfacing, but interfacing is something we've been wearing on our bodies for many, many years, decades and decades and decades. I really do think interfacing is quite safe. Of course, it's possible to make a mask without the interfacing, but I do like that extra layer. And then in addition to that, what I heard from people in other countries who have been fighting coronavirus for much longer than we have, is that if you insert a piece of paper, even just like kitchen towel paper or tissue paper or something, there's a little pocket in the mask where you can insert a piece of paper or an actual HEPA filter, like cut out of a vacuum bag, or people are using the type of material that you actually get in the air filters that you have in your house. They actually go out and buy those air filters and take them apart, which is a lot of work, in order to get to that material and then use that material to insert. But what is nice with the paper that is that it does absorb some of the water that we breathe out, because the masks do kind of start getting a little wet and stuff after a while. And so it's really nice to be able to take that piece of paper that has now absorbed a lot of the moisture and put a fresh piece of paper in there to kind of freshen up your mask during the day. So those are kind of some of the ideas and concerns or thoughts that I've had about all of that. Some of the things that make a healthcare mask as safe as it is the fit. So I have been working on coming up with a design that fits the face really well and creates a good tight seal while still being comfortable to wear for hours and hours. I'm thinking you're going to a movie, you're going to a concert or something like that, and you're wearing a mask, and you want to have a mask that is comfortable to wear for several hours at a time. And then in addition to that, because time is of an essence, I have been working on making a design that is quick and simple to construct. A lot of home sewers have a stash of fabric at home that they can work from. Many people are quilters and not really used to fittings and whatnot. So the design that I'm coming up with is really quite easy to make. It's made from just a square of fabric, so you don't have any fancy cutting. And then you essentially fold it around the face, kind of almost origami style, and attach it to your face with elastic. Now, elastic does not tolerate super hot washing and drying very many times, so elastic might not be the perfect option for healthcare people, for people in the healthcare industry. But for people who are at home, I would say, when you chuck your clothes in the laundry and wash it on a regular cotton setting, this should be very, very clean, and that will kill the viruses, I'm sure. And then the elastic will last a lot longer when it's not literally cooked every time it is cleaned. So those are just some of the thoughts that I've had.
Who are these masks intended for? Are they intended for people that are in the healthcare field or for the average public?
Well, right now, the critical need is for people in healthcare. So right now, most of the masks that I'm making are going to be going to healthcare providers. They're not going to be going to the ICU at Dominican or anything like that. They're simply not protective enough. But frontline workers like receptionists and nurses and MAs in doctors' offices and whatnot, I think would be well protected with these masks. And then I quite frankly also foresee a future of a new reality that we all have to live in, where more and more people are going to be wearing masks, like out grocery shopping, out, like I said, going to a movie or whatever, not to a restaurant because they do prevent you from eating. I haven't figured that one out yet. But personally, I have been wearing my masks around now for a little while, and for the protection. Also, it's really important to me that they're comfortable to wear. So partly why I've been wearing them a lot right now, even though I have been very sequestered over the last 2 weeks, is also to test the fit and the comfort of the masks, because I do think that is important. And the idea is to come up with a design that a home sewer with very little experience easily can make from whatever fabric they have at home. Preferably quilting cotton is a very good fabric to use for this. Most like apparel fabrics do not lend themselves well to mask making, just because many of them are either too thin or too thick, or some of the weaves, they're so tight you can't breathe through them. You don't want to breathe through like 3 layers of denim, right? You can imagine how hard that would be. So, you're trying to balance all of these different needs: comfort, protection, washability, longevity, all of these different kinds of things I'm trying to balance and coming up with something that really is effective and quick and easy to make for people. And that's when I finally came up with this mask that I've now been kind of sewing for the last couple of days. The feedback that I've been getting for people is that it's very comfortable to wear and easy to breathe, but it is 4 layers. So I wanted to make it so there was 2 layers of fabric that is cut on the grain, and then one layer of fabric that is cut on the bias so that the threads kind of go at a 45-degree angle to the threads that are cut on the grain, just to make kind of a tighter filter there. And then I put in a layer of heat-blown, non-woven interfacing. And that, because it's non-woven, the fibers is kind of in a much more kind of chaotic way than the structured way. So it just adds another layer of filtration. And then, of course, they have a pocket so that people can like insert another filter, like if they want to cut something from a vacuum bag or a filtering cloth or even paper towel. I mean, I know paper towel in and of itself, I don't think has been proven to actually stop anything. But from what I understand from people in other countries who've been wearing masks for a while, they say that it's really nice to be able to put a piece of paper towel in because it absorbs a lot of moisture, and then you can take that out and throw it away and kind of freshen up the mask if you're wearing it for a long time. But of course, a higher filtration material would also work. Though, of course, you still want to be able to breathe through the mask. That's kind of the key, right? So, but I really got excited about it because between all the fabrics, one friend gave me like her quilting scraps, and there's all these like super cute little things that I'm then using for like the bias cut piece in the middle. So when you open up the pocket, there's like a little surprise there, some cute animals or some flowers or something, right? To just kind of make them so that they're nice. It's really important to me that they feel nice and that they look nice, and it's something that people would want to kind of hang on to at least for a little bit. So
I understand you gave your final design a name.
Oh yeah, I named it after my cat because he owns the house anyway, so at least the home. So I call my mask the Rascal Mask just because there's so many masks out there, Easy Sew and all these names that are already taken by people who are much quicker than me. So I just defaulted to calling them Rascal. And I put my instructions up. I have them just in a Google document. I've been sending them out to friends and whatnot to kind of get their feedback on how easy or difficult they are to make, and I've been getting good feedback from people. Those who've made them so far have liked the instructions and liked the way that the masks turn out.
So this is part of the ingenuity of the people living here in Santa Cruz.
It is part of that, yes, for sure. And like I said, a lot of people are talking about masks, innovating around masks, getting together to buy supplies and things like that in order to get everybody in our county, or everybody everywhere, to wear masks until this virus dies off, or whatever happens to viruses.
Well, thank you so very much, Jonna.
You're very welcome. Thank you, Jean.
And good luck with making all your masks.
Thank you so much. I'm on it. I'm going to be working late tonight. Bye-bye.